Thank you so much. Thank you, Dr. Chaube, for being with us, and thank you, chairpersons. I will take the honor to invite our next speaker, Dr. Rajesh C. Shah. Sir is the head Department of General Surgery, Newton Medical College, Visna Nagar. Sir is also the president, World Association of Laparoscopic Surgeons. Sir is the double postgraduate in general surgery and gynecology with qualification in law and management. He's also an awardee of Father of Medicolegal Science, and today he's being awarded the presidential oration on violence against healthcare workers and hospitals, global problems and solutions. I request your talk, please.
Good morning. It's my proud privilege to be here with you all as a president of the World Association of Laparoscopic Surgeons. Being from Gujarat, I brings the greetings from the land of Mahatma Gandhi, Sardar Vallabhbhai Patel and Narendra Bhai Modi. Friends, in today's practice, even today's newspaper also having a news at Gujarat, a beating of some doctor. So it is in day to day, the violence against the healthcare workers and hospitals, and it has become a global problem, not in India, but everywhere. Mahatma Gandhi, the person who put the idea of non-violence, he believes that I object to violence because when it appears to do good, the good is only temporary, the evil it does is permanent. And these were the ideas of the Mahatma Gandhi. I have nothing to disclose here. But what we are seeing is the situation.
Bad food items, food poisoning, patient dies in hospital. Let's hit a doctor. Bad habits, heart and liver is bad. Patient dies in hospital. Let's hit a doctor. Bad train, accidents, patient dies in hospital. Let's hit a doctor. Dirty city, dengue, child dies in hospital. Let's hit a doctor. Dirty air, asthma, child dies in hospital. Let's hit a doctor. Bad government, health infrastructure, complicated case, child dies in hospital. Let's hit a doctor. No money, but doctors should serve free. Let's hit a doctor. We are those who will never question our politicians, never hit a corrupt babu, never hit a corrupt businessman, never hit a rapist, never hit child molesters, never hit bad drivers, never hit bad administrator, and never hit a terrorist. We are the ones who will only hit the doctors. Can somebody suggest a doctor who can treat this ailing society?
Healthcare workers are 4 times more likely to be the injured, and it's a global issue world over, this being faced by the healthcare workers. 8 to 38% of health workers suffer from the physical violence in their lifetime. The number 1 at present in Indian statistics is obstetric and gynecology department, followed by medicine, surgery and the emergency departments. 75% of the doctor face the assault at the workplace. This is data from the Indian Medical Association, and 70% of the doctors feel unsafe while treating. And this is a real scenario. When the patient comes to the doctor, he will always say, doctor, आप तो भगवान है हमारे. आईसीयू से जब वार्ड में शिफ्ट होता है, सेटल होता लगता है, तो वो सब भगवान की माया हो जाती है, डॉक्टर खिंच जाता है, और जब छुट्टी होते वक्त बिल मिल जाता है तो डॉक्टर डाकू बन जाता है. दिस इज द रियल सिनेरियो एंड डे टू डे प्रैक्टिस. एंड नाउ मेडिकल प्रैक्टिस इज ऑल्सो गोइंग टू बी चेंज्ड, एंड एवरीवन विल हैव टू लर्न समथिंग like this. This will be around with all protection and all these things. These days are not far away. What are the types of the threats a healthcare worker is getting? It may be a telephonic or a verbal threats. It may be a physical assaults or a vandalism. There may be a revenge taking with careful planning. And it is usually by the relatives of the patient, the aggressive bystanders, many political party members, and local goons or persons in power may attack the doctors to create themselves as a hero of the situation. What are the common causes of the violence specifically seen and the reasons behind it? So, if we see, the most important is the inadequate doctor-patient ratio in our country, as recommended by WHO is 1,000 to 1, but we are below 3,000 to 1. There will be a miscommunication and poor communication. This is another cause. Misconception against certain diseases and the surgeries. This also causes the cause for violence. Economic shock for the patient or the relatives when the bill is given. The unrealistic expectations from the patient and putting first patient by doctor situation in the God and later on not getting the results, that also creates the problems. The poor infrastructures in majority of the hospitals in our country, the lack of adequate security and crowd control measures are there in the hospitals, and that is also creating the cause for the violence. Sensitizing by the media. This is a great thing. If you see a small swab in the abdomen, 5 times, 10 times it is shown by the media, and that creates a lot of problems. Insensitive and uncontrolled electronic and social media, that is the great cause at present. Within 5 minutes the news spread like anything. People are having an increased intolerance and the restlessness. There is a lack of laws and their implementation. Laws are there, but its implementation is a zero. The political interference is a big way in our country. The poor grievance redressal system and low health literacy in the population, that is also leading to these causes of violence. The psychopathology of the transfer of one's guilt to another, that is also leading to violence in the hospital. And politics plays a big role. They create the problems. Where the violences are happening, corporate hospitals because of big bills, improper consent taking, lack of compassion, autonomy of the patient, partial disclosure and medicolegal cases, and death where inadequate application done, that creates the violence. Delhi, where we are at present, have a Medicare service personnel and Medicare service institutional prevention of violence and damage to the property act, which was in 2008, but very few cases are noted. And see the penalty. If someone is found guilty, the penalty is only 3 years imprisonment or 10,000 rupees of fine. So this odd words is a big thing, and that makes it insecure. The different scenario in Punjab also, nearby state. If we see the total country as a whole, only 23 out of 28 states are having the law for the protection of their doctors and healthcare workers, and only 2 union territory out of 8 are having this act. Any damage or act of violence against the medical professional is punishable by the law in these 23 states and 2 union territory, and the difference is very big. Imprisonment to lawbreakers for a minimum period of 3 years and fine amount of 50,000 to be imposed if found guilty. If you see Madhya Pradesh, there is the lowest only 3,000, and 3 months jail and 3,000 rupees is the penalty, and highest is seen in the Arunachal Pradesh, where 3 to 10 years is the jail and 5 lakhs are the penalty. So if the law is strict, that definitely helps us for the situation. The Supreme Court has given some verdicts which is much favorable and desirable to know here. The medical professionals cannot be held negligent merely because the treatment is not successful or patient dies during surgery. And this judgment is very helpful judgment for many of the practitioners. What we can do, what is the way forward for all of us? An important thing, we have to take the legal protection, indemnity insurance and the help of the medicolegal experts. Let us have a legal cell in majority of our associations. There should be a security deployment in the hospital premises. Also deploy the CCTV cameras. Do the ethical practice and with full of moral within yourself. Let there some structural changes in the hospital that can protect the staff. let different types of training and standard operating procedures created in the hospital. Code system has to be employed, and let's have a distressing station inside the hospital. The National Task Force was created by the Supreme Court of India in the last where RG Car medical case has happened, and the National Task Force has a good recommendation, and there is one suggestion inside that which is very useful and notable, that should healthcare workers to be given a status of the public servant. This will definitely automatically give, if this status is given, it will give immunity to the hospital staff if a status of the public servant is given, but still it is under consideration. The insurance is very important. Take a full insurance in the hospital for both the staff, healthcare workers, as well as the doctors. If you do not have a proper insurance coverage, you may have a trouble in the problem. There are many laws around. We can narrate 53 laws which are acting on the medical practitioner, and we have to be a safe practitioner if we want to make these laws away from us. And the real scenario today is the medical practitioner lacks lot of unity. I had one discussion with one Supreme Court judge, and I asked him a question, why there is so many decrees against the doctors and not the advocates. And he also made that there was one case in Chennai before 15 years back, and one advocate was cuffed up by one of his client, and at that time there was 13 days strike in the entire nation. If a medical professional can show such unity, they will also be protected. But that unity still we are lacking. In the picture is also shown, if we feel safe, we never come across that. The day may come where we have to face. So friends, I would put few important points, and my short name is Dr. RC Shah, and put RC, remember RC, to have a legal immunity. And what RC means? Record completely. Your record should be completely chronologically and crystal clear. Always respect your colleagues. Never put any doubts on your fellow colleagues. Rapport with the client is a very important thing, and if you create a good rapport, you will not have to be in the court of law. And make a principle to provide the reasonable care with a reasonable cost. If the cost is reasonable, I think you will not have to face any legal situations.
Why are healers seen as enemies? Why can't we protect the hands that heal? Doctor is not just a regular role. Doctor is passion, sacrifice, responsibility, and the last hope of life. Why the abuse? Why the agony? Why the disrespect? Why the pain? What's there for you to gain? Remember, they are doctors, they are adorned in white to help people at their most vulnerable time to feel finer every day and night. Do not subdue our profession. Do not question our education. Do not leash our personalities. Let's salute our most disrespected warriors who boldly performed their duties during the pandemic, saved your hand by putting forward theirs. Break the silence, save those hands. Violence against doctors is simply violence against humanity. It's unjustified. Masked, not muted. Say no to violence against doctors. Why are healers seen?
We have to demand a change in the Bharatiya Nyaya Sanhita, where there should be a special law for the medical practitioner, and that is the main demand we have to carry out. Thank you very much.
Thank you, Dr. Shah, for bringing out this this is a reality, but unfortunate thing which we are facing, and this is, we have to tackle it very judiciously at all levels, because so much so that some people won't like to come into the field of medicine, and we are losing brains which would have served the humanity. They would go to other professions.
Yeah.
So I think we have to tackle this. It's a global problem, but in India it seems to be
On a higher side.
on a higher side. Thank you very much.
Thank you, sir. Thank you.
Thank you so much, sir.